In the past decade, the controversial issue of legalizing euthanasia has been a topic of debate around the world. Euthanasia is the painless killing of a patient suffering from an incurable and painful disease or in an irreversible coma. Currently, the only countries to have legalized euthanasia are the Netherlands, Belgium, and Luxembourg. These countries face harsh criticism for their decisions to legalize euthanasia. The common belief by many is that euthanasia is just another name for murder. They believe that legalizing euthanasia is no different from allowing a criminal to kill an innocent victim. By focusing on the killing aspect of euthanasia, opposers overlook the deeper problem of a patient's pain and suffering. Take Chantal Sabiri, for example. In the year 2000, Sabiri was diagnosed with a rare form of cancer where the tumor grew in her nasal cavity. Not wanting to take any risks, Sabiri refused surgery and medications. As time went by, the cancer burrowed through her sinuses, nasal cavities, and eye sockets, leaving her face severely disfigured. She also lost her ability to see, smell, or taste. She refused to use morphine because of the side effects. In 2008, she made an appeal to the French president to allow her to be euthanized, stating that, quote, "One would not allow an animal to go through what I have endured." She lost her case in French court and was found dead a month later. Her experience goes to show that in cases like hers where death is inevitable, why not allow the patient to end his or her life early to avoid the suffering they will have to endure? Despite this, many people still quote the Hippocratic Oath, which is the basis of many modern medical oaths. It states that, quote, "Nor shall any man in treaty prevail upon me to administer poison to anyone, neither will I counsel any man to do so." This line effectively prohibits doctors from administering euthanasia, as the very point of it is to kill the patient. However, one must remember that the Hippocratic Oath was written centuries ago. Over time, the oath has been modified to fit modern medicine. Lines that once referenced women being prohibited from studying medicine and doctors not breaking the skin have been deleted. With the advances in modern medicine, we have developed a way that will painlessly end a person's life. If a patient is suffering through a lot of pain and death is inevitable, an oath written over a millennium ago should not be the reason why we refuse to mercifully end their life. Also, the role of the doctor has changed. A doctor's sole purpose is no longer to prevent death, but to improve the quality of a patient's life. Many times, a doctor may be unable to prevent a patient from dying, especially in cases of terminal illness. All the patient can do is wait for his or her death. This waiting time can prove to be very painful for the patient. It is the doctor's job to ease the process of death for a patient, and if the patient believes that euthanasia is the easiest way for them to go, then it is the doctor's job to fulfill their request.